Hi, and welcome to the Membership Healthcare webinar. We have Jim Dustin and Brian Hirsch from NFP. We're going to do a little housekeeping first. Obviously, everybody is coming in muted. Jim will go through the presentation. In the event that you have any questions throughout his presentation, there is a question box. If you could please put your questions in there. We will go through the Q&A at the end, and I will then at that point unmute whatever question we're going through, and that way you'll be able to have dialogue with Jim or with Brian. So without further ado, I will turn it over to Jim.
Thank you, and good afternoon, everybody. We're happy to be here to talk to you about the healthcare and ancillary plans that the NTMA is sponsoring. This is the culmination of about 7 months worth of research and work with the folks at the NTMA. And hopefully in the next 60 or so minutes, we'll cover a number of things that will help you through the process. In terms of the topics that we'll cover today, we'll cover just the commitments and feedback that we got from the members as we were building the program. Talk a little bit about Etna, which is the key healthcare partner, some of the parameters and timelines that we're dealing with, as well as the proposed plans. We'll talk a little bit about Guardian, who is the ancillary provider, what their key parameters and timelines are. We'll spend some time talking about the NTMA and its role, as well as the quoting process. We'll also spend a little bit of time talking about the technology that anchors the whole program, which is eCentral, and then the role of NFP in the technology side of the business, and then how the program will be distributed. In terms of the program providers, as I said, eCentral is the anchor relative to technology. All of these programs sit on a technology platform designed to give you significant advantages in both systems and support around benefits delivery. Our healthcare partner is Etna. They're one of the largest national providers of healthcare in the country. And then Guardian, who's also a very large national provider, provides all of our dental, vision, life insurance, long-term disability benefits as well. So just to give you some general sense of how the program was developed, typically when we build these programs from the beginning, it's relatively difficult. But the goal, first and foremost, was to deliver a sustainable benefit to the members in a program that would ultimately be less costly for folks. We heard through numerous interviews with the NTMA that a lot of members were struggling with the cost of benefits, both not just the ever-increasing cost of it, but also that up and down sort of unpredictability of the process. So one of the goals was to try to make it more predictable and less costly over time. We also wanted to try to create a workplace asset for you, the members, in terms of employee retention. We believe that the programs that we've set up will help you do that because there's some unique bells and whistles tied to the programs that are unique to the NTMA. And then thirdly, we wanted to accomplish large group treatment of the NTMA. So most of the members are all under really 25 lives. So a lot of you are subject to community rating in your various states. And that can be good or bad for lots of you. You can debate whether or not it's worked for everyone, but there's clear advantage in being treated as a large group. So what we've been able to negotiate through these carriers is all of the NTMA groups that participate will be treated as one large group and have the advantages that come with that in terms of renewal and scale. On the NTMA side, the hope was to create a value-added member program, which we believe we've done. We're hoping to also increase member retention through these programs because you do need to be a member in order to be part of them. And then also use it as a recruiting tool. And we think, again, we've accomplished it across all goals. I think the process will take some time, and there may be some bumps along the way, but as we continue to build it, we will work through all of the process and procedure to make sure that it's smooth for the members. We do know, too, that we have pretty reasonable targets to hit. And that was important because we want to remain viable for the long term. So we don't have unreasonable goals. in this process. We think they're very attainable, and we think that the programs will ultimately be very large and very sustainable and allow the members to have far greater benefits over time. We do know too that because we've got a state-by-state rollout, that information is important. So even though you may not be in a state that is initially covered, we would hope that you would at least participate in the process, because the more interest we have based on the states that submit information, the greater ability we have to expand in a quicker fashion. So again, as I said, it's important to gauge that interest, and that requires some information from all of your members. And we also would like to get your feedback. We do know that we've got pretty good processes established, but that doesn't mean that the processes can't be made better. So as you go through the process, if you do have feedback for either NFP or for the NTMA, please provide it through your various channels. So let's talk a little bit about Etna. This seems to be what most people are interested in, is obviously the healthcare side of the business. So we did a lot of research with the members that submitted information when we were going through the research project, and we've decided to narrow this process to 5 unique plan designs through Etna that cover a range of benefits. So for those that are subject to ACA, you'll have programs that meet all of the minimum requirements. You'll be able to offer multiple options within this menu, so you're not stuck with just one benefit design. And we do believe, based on the research that we've done, that it covers most everyone. Now, that does mean that, you know, it's not going to be, we can't match every benefit, but we are going to attempt to get close. There will also be some uniqueness. So we do know that, regionally speaking, in states like California, that there are more heavy HMO penetration than PPO, so we will potentially modify based on the states that participate. If in fact we need an HMO option, then we'll be able to add that to the menu as well. Our projected start dates are 1/1/18. We are currently in the data collection phase. That opened up right around November 1st. I think as of today, we've got about 42 members that have submitted information. So we're going through that process. The date may be pushed back. Again, this is a build process, so we need 300 employees to start the program. That could come from 30 groups of 10, 15 groups of whatever. We just need to get close to the 300 to get the program rolling. If we don't have enough interest by 1/1, then it could be pushed back to 2/1. The other issue that may delay it is that there is the potential for some legislation that came out to roughly 2 months ago. The president announced that he wanted to make some impact to ACA, and that association plans, of which this is one, may play a significant role there. They were not very clear as to what that actually meant. So we're waiting for some guidance to see if, in fact, we might have to do some other type of filing, either federally or at the state level, in order to make sure that the program continues. But as of today, we are moving forward business as usual. We, as I said, are in the data collection phase, and we'll continue to collect that information as we go along and release rates as they come through. As I said, we need 300 employees. This target was established by Etna. It will allow us to be both credible and valid as an association distribution channel. And then our first year target has no maximum. So if we get more than 300, that's great. If we get slightly less than 300, we should be fine. We just can't start with 50 or 75. So in terms of the future targets, we're really looking to try to grow by about 1,000 employees a year, and we think that's a very achievable number. It could be more or less. It's just what the internal targets are set at. As I said, our data collection began on 11/1, and then final rates will be confirmed 30 days prior to the effective date, which should be starting right around December 1st. If we go farther into 2/1, then it could be a little bit later. But we do know that we have rates that are being released now. I can tell you based on what we've seen that the rates are competitive about 40 to 50% of the time, which is within our targeted range. Rates may or may not be competitive for a number of reasons, everything from benefit design to the type of network that you're accessing could affect the rates of those plans. But we believe that we've got what we asked for, which was an average savings target of about 3 to 5%. What that means is that some people will see more savings, others will see less, or they may not see savings at all. Again, so that we expect that this is a long-term program and that we will be sustainable. That doesn't mean that we can take everybody the first go round. Hopefully, you continue to look at the program even if it's not competitive during this iteration. So that said, we got the okay to roll out in 6 targeted states. Those targeted states were really developed based on the amount of membership in the states and whether or not there was active interest. Ohio, Indiana, Pennsylvania, Texas, California, and Missouri. Missouri is no longer pending, are the 6 core states. We've also had, as of today, significant interest from Arizona and Connecticut. We are working on the compliance components of those, and we would expect to have some answers on whether those states will be open for this first iteration within the next few days. And as I said, our average savings target is about 3 to 5%, and we think that is sustainable, and what we're seeing out of the system would indicate that that's accurate. So these are the plan designs that we have. As I said, they may be added to as we go along based on regional requirements. We have a PPO platform, so it is the widest access network that Etna offers. We know that from particularly some of the data collection that some of the organizations have what we call narrow network models. These are very popular today within certain states. So most of these programs would be expanded networks beyond those. But you can see that we have a base plan. That would be for those that are ACA compliant today, compatible with your bronze level plan that you need to offer for affordability. We also have an HSA offering. We then have 3 PPOs that range from about a $2,000 deductible, 90% coinsurance with a max out-of-pocket of $6,000 and $12,000, all the way up to a $500 deductible, 90% plan that would be considered typically high-level gold, low-level platinum, if you're looking in the ACA world or community rated world. Each one of these has a drug card with the exception of the HSA, where the drug card applies only after the deductible. But we believe that this is pretty competitive. You've got a $10 drug card for generic, $45 for your brand preferred on the formulary, and then non-preferred formulary brands would be $70. Any specialty medications would be covered at 30% up to $250. So one of the nice things that Etna was able to do for us was include some value addeds that are unique to the NTMA. Early on in the process, it was discussed what role wellness would play in the NTMA programs, and it was pretty clear that most of the membership, as well as the NTMA itself, wanted to have a healthy population, and therefore anything we could do to build in wellness would be good. So Etna's included teledoc services. These would be considered either video conference or telemedicine services for all of your members. We also have a free biometric screening that's available through Quest Diagnostics. So for those entities that have some type of wellness program where they're paying for screenings, you can now get those for free through this program. We also have Etna health risk assessments. And there's a $50 gift card that's built into this program for every member that completes them. So for those that offer some type of incentive, if you're completing a health risk assessment, this will be a way for you to alleviate some of those costs as well. We also have some of the standard benefits like 24-hour nurse line. There's an active social networking app, as well as decision support tools around, you know, where is the most qualified and least costly provider near me. There's also a health library and a preventive schedule. And then we also have what's called neighborhood well-being services. These are actually counseling services tied to some of your chronic conditions that you can access directly through CVS stores, local CVS stores. For those that are suffering with chronic conditions, this is a very nice opportunity to be able to help manage those in a format that ties you right to your local pharmacy. So in terms of the Guardian, Guardian, as I said, is a large national provider, particularly around the dental. They've got one of the widest access networks that you can find in the marketplace. These programs were actually much easier to set up because they require less regulatory oversight. So they actually became available as early as December, so we've been actively quoting those programs. And they have not given us any hard and fast goals. So we know that the programs, whether we reach 300 members or 50 members, will be up and running. There is a 2-year commitment to this program that's required. Again, in terms of the commitment, and I would say this is true of the medical as well, the commitment is to the NTMA, it is not to the carrier. So while there's no contractual obligation that would require you to stay in the program with the carrier, the NTMA is asking that you agree through your participation agreement to stay within the program for 2 years so that we can try to create some stability. You will be pooled as an organization, so for those that are getting, you know, small group renewals or, you know, just general market renewals, this will be a pooled renewal based on all the covered lives that are in the program. We've exacted multi-year guarantees for all lines of coverage. We've got no participation requirements. This is probably the biggest single factor in determining why Guardian was chosen. We found out through our research that a lot of your organizations are offering ancillary programs on a voluntary basis. Voluntary product generally has participation requirements, and that can sometimes be very difficult. So in some cases, we had members who would offer the programs, go through the process of enrollment, and then not get enough participation, and then have to rescind those programs. Here, we don't have that issue. So whether you're offering on a voluntary basis or an employer-paid or partially paid basis, you will not have any participation requirements in this program. We've standardized all of the programs for groups under 25 lives, and anyone that's greater than 25 lives can have full customization. So what that means for organizations that are above 25 is that we can match any program that you have relative to benefit design that's out there. There may be some small things we cannot do, but in general, we believe that we can fully match whatever programs exist. The other nice thing is we were able to get higher guarantee issue amounts based on the NTMA itself. So for those that typically have less than 25 lives, you get very low guarantee issue amounts, and for guarantee issue, that means that there's no requirement to fill out any medical evidence of insurability. So if you're sick, you'll be able to get guarantee issue coverage without any questions. So the guarantee issue on the life side for 25 lives or less is $50,000. For groups that are between 26 and 100 lives, that's $100,000 worth of coverage, and anything 100 plus has $200,000. For those in the 100 plus category, if you've got potentially higher guarantee issue limits, or you have, say, key executives that have special programs, we can grandfather those in and they can be duplicated. The rate guarantees on dental are typically a minimum of 12 months and typically can be extended to either 18 or 24. For everything that we've seen going out as of now, have all been 24-month guarantees, and then all of the other lines of coverage have 2-year rate guarantees. In terms of historical performance, we run a number of these pools nationally, and I would tell you that the average increases over, say, 5 years in aggregate are 3 to 5%. So lots of zero increase costs over the long term, and we believe it outperforms the market consistently. We do know from the information we've been pushing out that members are seeing 7 to 10% below their current rates on most lines, and in some cases we've seen it as high as 20% less. The value adds that are in these programs would include will prep and legal services. This is offered through Work Life Assist, which is an EAP program. We also have travel aid and assistance, so that if you're traveling and you need emergency evac or medical transportation overseas, that you can access that through Guardian. You have enhanced AD&D benefits, and then for those that have never been with Guardian or are unfamiliar, we've also included the dental annual maximum rollover. So this is a nice benefit that allows folks, if in fact they get their cleanings once a year and they don't use their current annual maximum, then they can roll over a portion of the unused maximum year over year, so that if they do have large dental expenses in future out years, they'll have higher limits to be able to access those services. The other nice benefit, and this is one that's unique to NTMA and large groups, would be the college tuition benefit rider. Now, while this does not apply to every college, and I want to be clear about that, there is a list of colleges, they're private universities located throughout the U.S., where Guardian will actually pay, if you're part of the program, a tuition credit back to the student or to the parents of up to $4,000. So it's a nice little benefit to get some extra money if in fact you're utilizing one of the colleges on the list. So in terms of the NTMA and its role, first and foremost, the NTMA wants to foster membership and provide a benefit program that has value to its current members. Because of that, anyone who joins this program needs to be a member of the NTMA, and it will always be that way. We want this to be exclusive, and we want to, over time, as it grows, be able to add value in new and exciting ways. So that's going to require everybody be part of the NTMA. They will use their existing promotional force, their local reps, to promote the product, and then we'll talk a little bit more in detail about how it will be distributed through brokers and agents. We recognize that most everyone on this call, as well as most of the organizations that belong, have some type of relationship with an existing broker or consultant who helps them procure programs. We spent a lot of time with the NTMA talking about how this program was going to be delivered, because this is one of the major areas where programs fail. Relationships are strong, we recognize that, and to a carrier that we looked at, every one of those carriers recommended that we operate in what's called a narrow distribution model. That means we would select a number of brokers regionally to train and distribute the program on behalf of the NTMA. Now, we recognize from a chapter perspective that you have a lot of local folks in the insurance industry that may be sponsors that want to access this program on your behalf, and we are happy to entertain them and put them through the selection process. So we'll talk a little bit more about that as we go through this, but know that that will be an option as well. All of the quoting will flow through the NTMA website. That's at www.ntma.org. The website is up and running now, and you can submit information. We'll talk in greater detail about that. And then lastly, the NTMA is going to provide direction and guidance at the program level. So their boots on the ground will be assessing the program as it goes live, getting member feedback, making sure that that member feedback is brought back to us and that we modify either process and procedure or potentially benefits that members want. So it's important, as I said, to provide that feedback. In terms of the quoting process, as I said, everything will be submitted through the website. And I would tell you that we've tried to make this as easy as possible. So we're not asking for any information typically that you would not provide through your current marketing process, either through your broker or on a direct basis. There is an NTMA proposal request form. It's out on the website. We'll need that completed. We'll also need your current plan designs for all of the lines of coverage that you want to access. And let me be clear also that you can use either one or the other program. You do not need to use both. So if you want to just use the ancillary programs, you can do that, or you can utilize the medical programs. And the way we've designed it is that if you only want the medical, you only have to complete the medical section. If you want the ancillaries only, you only have to complete the ancillary information. We'll also need current rates for all of your lines of coverage. We need this for two reasons. One, the carrier requires it for underwriting. Two, it will help us build a database to understand the competitive challenges that we may have in given markets, and then be able to assess kind of how the program looks overall. If you're above 100 lives, then we'll need your current experience. This should be given to you typically by your broker or your carrier on an annual basis. Typically, you get some type of reporting for all lines that are being quoted. This would include your medical, your dental, and or your short-term disability. We won't need any life insurance experience, but for those lines of coverage, we will need it. And then I will stress this. Partial information, groups without prior coverage will be rejected through the website. In this initial rollout of the first 41, the website wasn't fully operational, so we did take information from folks. If some of those folks are on the call today, we've been working with your offices to get that balance of information that was either not submitted or was left out of the process, and you will get rates once all of that information is complete. But on a go-forward basis, if you're working directly through the website, you need to complete all of the information and then submit it, otherwise it will be rejected until it is completed. There are some specific guidelines relative to group size. So once we receive the information, essentially the following will occur. So groups under 20 lives that are enrolled and have prior coverage, you will access what's called Form FIRE. This is an application process that is universal to the industry. Most small groups, unless you are community rated, are using either Form FIRE or a program called Easy App. In this case, the NTMA is using the Form FIRE application process. This is a process that's electronic in nature. Your employees will be required to go into the system, complete an application. It will include everything from, their name, address, etc., to the types of medications and illnesses that they have. All of this is done in a HIPAA-compliant fashion and is fully secure. Once they've completed that information, it'll be submitted through Form FIRE, and then you will be rated accordingly. If you currently use Form FIRE, and lots of you possibly do, there's a process to transition the Form FIRE information over to the NTMA. You can do that either through the NFP contacts or the NTMA directly. Once we have access to that, we'll gather the information that we need, and then we will return the Form FIRE program back to the current agent. Once it's all completed, rates will be finalized and distributed out to the organizations. If you have over 20 lives and you have prior coverage, Form FIRE is not a requirement. A very nice feature of the Etna system is that they use the GRX programming system. This is a system that only requires a member level census. And then What they do from there is that they look up through the member level census, they match it up with prescription drugs that the members are taking potentially, and that's how they generate the rates. Once all of that's done, rates will be generated and finalized 30 days prior to the effective date. So when you get rates, I will say this, you're going to have to make a decision whether they're competitive first and foremost, and we'd like your feedback on that. And then secondly, whether or not you believe that this is going to be something that you want to participate in. We are not looking initially for an absolute yes, but if you are interested in the program, we need to know your level of interest because that will help us solidify the rates for the effective date. So as I said, we need 300 people, 300 employees to get this program started. As long as we're close, those rates will be good and finalized, so indication of interest is extremely important. So I want to spend some time talking about the technology platform. In this process, while it may seem to be a simple thing, we believe this is probably, from a long-term perspective, the most important part of the program. The good news is that the platform that we're giving you, eCentral, is at no cost to the member. If you use one of the NTMA programs, you will get this system for free. That means also that if you choose to leave the NTMA program, that you would lose access to the system. And then you would have to go directly to eCentral to purchase it. But because it's being offered through the NTMA, it's offered at no cost as a function of this association program. So it is affordable. It's also, completely robust. So it will allow you, from an electronic perspective, to systematize much of what you do in terms of benefit administration. We recognize through this process that lots of the organizations have either limited or no HR capability in terms of a dedicated resource. So this will make the process much simpler. We also know from research that a lot of you struggle with compliance. This is a full compliance tool. It will help you both in terms of your ACA compliance and testing. It will also help you just purely from a documentation and compliance perspective. Because it's an electronic process, employees will actually be onboarded through the system either as a new hire or through open enrollment, and they're required to use a wet signature. So for those that struggle with getting things like waivers and making sure that they're documented and in a file, this is a great resource because it's all stored electronically. In terms of documents, it will assist you because it can hold all of your current handbooks. We'll load everything for you into the system. It can be as robust as you want it to be. So, and it's fully customized to your organization. So it will look and feel like each one of your organization has a tool that is specific to them. All of your notifications can be done through the system, and your HR folks or your CFO or whoever's handling that HR function can track everything electronically and report back. Again, as I said, it's also an enrollment tool and will allow people to compare plans, apply for coverage if in fact that's what they're doing, and submit their information, and then keep track of it as they go. Because it's electronic in nature, they can actually go through the system, and if they don't have all of their information and need to stop, they can stop, and it checks them at that point, so when they re-enter the system, they can finish and complete. One of the other nice features is that it can actually tie into your payroll. It does integrate with a number of payroll providers. Currently today, they're embedded in the system like ADP, Heartland, which I know is an NTMA partner, and a number of other providers. So you can actually connect with your payroll system so that all of your deductions flow freely across. For those that are ACA compliant or need to be, it has modules to track variable hour employees to help you determine if you are a large group provider and be able for you to document everything that you need. And relative to that, I will tell everyone, if you have not seen it yet or seen anything in the newspaper, the IRS is starting to crack down on the penalties. We at NFP have seen at least 4 clients in the last 30 days who have received requests for payment of penalties for being a large group provider potentially and not providing coverage. That doesn't mean that they would be penalized. It just means that the IRS, either because the reporting that they received was inaccurate or they misfiled the information, that they in fact have to go back to the IRS and then prove that they are in fact a large group provider and subject to ACA or not. So be aware of that, and this tool will help you in that process. So why online enrollment? We know that this will make you more efficient in your HR process for a number of reasons. One, it's all electronic and paperless, which eliminates the need for you to chase down paper forms. It will reduce errors. So no more handwritten forms. I can't read this information. And you having to go back to employees to try to get clarification of what they meant. And it will give you access to real-time updates and progress on the enrollment. We know consistently that one of the biggest problems HR folks have is that they've got to chase their employees to get this process done. This cuts that out. Employees go into a system, they enroll, they pick their plans, and they complete. Once they complete, they're going to get a confirmation statement that they're done. You as the HR person can see it in real time as they complete it, and we've given you tools to be able to communicate with people electronically that will allow you to keep tabs and prompt people to get it completed. It's very easy to set up. So on your end, there's very little that you're going to have to do. You'll have to submit your company logo and information. NFP will act as the technology resource and build out the sites on your behalf on an annual basis. So that means that even if you change things, you'll be able to have a resource to be able to help you complete that information. I would say also that this is just not exclusive to the NTMA sponsored programs. If you want to house your 401k information on this platform, build a link in, or any other types of benefits that you offer, we can do that as well on this system, and so that it's unique to your folks. We're trying to create efficiencies in this process. We believe that long-term this will be more efficient for the NTMA, and it will also be more efficient for you as an employer. And we lastly know that it will increase employee engagement. This is a fully HIPAA compliant process. It meets the highest levels of encryption because it is storing in lots of private information. So your employees will get unique login IDs. They then need to change those passwords to be unique to them, and then they can go in and learn about all the benefit options that they have available to them. The system is set up at a 6th grade level. It's very intuitive. It doesn't require a lot of training, either for your employees or for your HR folks, but under the auspices that someone will need training, we will provide that as well. So what are some of the things it can do? We talked about the fact that it can handle your open enrollment. It'll handle all of your new hire enrollment and qualifying event changes that come through, and it'll all be handled through one system. We know that employees can follow up on missing and incomplete information, and again, the system's intuitive. So if you leave the application, it doesn't make you start all over again. It will just continue on and allow you to complete. Good news for HR is that it runs consolidated billing reports for your final enrollment premiums and helps manage that process of reconciliation. All of your wage withholdings are automatically calculated for your payroll department and produced in easy reports. And then, it's got this full system of communication that you can make as robust as you want. So we can build in unique messaging for you as a customer. If you want to communicate certain things about your program to your employees, it can all be done through this site. It will house all of your documents that you provide on an HR basis, everything from your SPDs or SBCs to links to education plan tools. We can embed videos about what is an HSA. There's a number of tools that we can add in. The great thing for you all is that it does give data input verification. One of the biggest problems we see employers having today is that they don't store their data very well in terms of the sign-offs that they need from an employee for not just healthcare things, but everything that they would need an employee to sign off on, particularly through an active enrollment in ACA. This will do that for you, so that you've got an electronic signature through the system, and no one can ever come back to you and say you didn't offer me something. It will provide a confirmation statement to the employee, telling them what they've chosen through the process. If you've got multiple plan choices, it'll tell them what plan they chose, what it's going to cost, and all the other benefits that they may have access through the system. And as I said, HR can pull reporting at any time through this process. So it's a real-time system that you can watch. You can see who's elected and who hasn't. You can message those that have not elected, their coverage. So it's pretty slick. It'll download everything then into carrier-compatible forms, so that your carrier, and you'll have records of those as well. And as I said, it's all branded to you specifically, and then it's powered by the NTMA. On the HR side of the program, because as I said, this is a highly configurable tool, and there are modules that you as an employer can add onto directly with eCentral. If you like the system and it becomes part of your daily process and you want to make it more robust, it has that capability. But the basic system that you'll get that's at no cost to you is highly configurable, and it will handle all of your enrollment. From an HR person's perspective, it will allow you to set up all your new hires so that they can elect their coverage. It'll allow your employees to modify their information, so if somebody changes addresses, moves, gets divorced, that you can modify all of that employee information in the system. If you want it segmented by departments or locations, because that's your setup, we can do that. And it can also process all your new hire and family status changes. As I said, it's got pretty solid reporting capabilities. Most everything that you would typically access is standard on the system, and there is some ability for you to develop and customize special reports if you need them. You can even modify things to be date range specific in terms of reporting as well. And everything is put out to you on a dashboard. So the nice thing, as I said, is you can instant message people through email. It does require an email, obviously, in the system, so there may be some challenges with that, but we can work through those processes. It will collect and store all of your I-9s and W-4s, emergency contact information, and give you, if you need employees signing off on workplace drug policy, workers' comp, reporting, anything that you would typically need some type of written signature, it does take wet signatures electronically. On the employee side, you can either make this as self-service to the employee as you want to or not. A number of customers we find typically want to ease their way into employee self-service. So if you are of the opinion that you don't want your employees really touching the system and you want it to be fully HR driven, you can do that. If at some point you want to turn everything over to employees to manage themselves, you can do that as well. Again, so employees can access this program anywhere, at home, at work, through mobile applications, etc. All of that stuff is available. And it doesn't really take any training, although training will be provided. It is fairly intuitive. It's not something that you can skip around in. You have to complete it through a segmented process. So it's fairly simple, and folks have a pretty easy time. But employees will log into the system. It's all single sign-on, secure user ID and password, and then the enrollment process is triggered. So employees can make their decisions. There is decision support tools embedded into the program. So if an employee is choosing between 3 plans, let's say, and they want to know which plan is best for them, they can use the decision support tools to help them choose the best possible plan. You will then ask them to verify that information, and then they will make sure that all of their dependent information is up to date. And that's also a good back check for those organizations that have, say, spousal waiver or spousal surcharge. You can use this process to manage that as well. Everything is point and click in terms of elections. Once they're finished, they'll submit their information and use the wet signature process with their mouse, and then they'll get a confirmation statement. Employees can return anytime to check their benefits. They can make modifications all the way up until enrollment is complete and the system is closed down. So this will just give you a sample of what it looks like. As I said, NTMA will power it. There will be some logo representation there. And then everything else that you see here will be customized to the employer group themselves. So if you have specific pictures or you already have a web presence that you promote, we can take all of that information, graphics, and plug it into this website so that it looks specific to your organization. And you should expect that you should treat this as such. This is a tool for you to use and manage, and ultimately, hopefully, we believe it will help you make your business more efficient and also be a benefit to the member. This is what it looks like from a member perspective. You can see in terms of it houses your name and your profile information on the left-hand side. All of your benefit information is housed on the right-hand side. In the center, we'll modify any type of graphical information or embedded YouTube videos. This one in particular is tied to the HSA and how it works. So if you want to try to highlight one program over another, you're looking to drive engagement, this will help do so. And then it will show you what those benefits are going to cost you. In terms of the HR side of the equation, this is what the HR folks can see. As I said, this is the dashboard. It will show you the progression of employees that have completed the program, those that are in process, those that haven't started, and it will allow you to customize your communication process to those employees. I think this is probably the single greatest function an HR person has, right? Most of you, if you're doing this type of work, are typically chasing down employees, or you're chasing down employees and trying to access their spouses. This makes it much simpler. You can go directly to the spouse if you need to get this information completed. Makes it nice. In terms of the optional modules, if you embrace the technology and you're really looking to try to advance what this can do, this can become a full HRIS system. This is a true benefits module system. It's rules-based. You can do everything from, org charts, paid time off, request and approval, performance evaluations and goals. You can manage your COBRA continuation through here, produce offer letters, termination letters. You can map all your employee workflows, etc. There's another module that will do all of your 1094 and 1095 reporting if, in fact, you are ACA eligible. And that's a nice feature. So if you're currently outsourcing that type of a function to a third party, this can all be done through the system. It can provide you high-level HR access through the HR answer link. And then the next level of HR support would be HR on demand, which is unlimited access to HR professionals, both online and over the phone, to handle complex issues. Can integrate directly with payroll. So we know from the central perspective that they integrate currently with Paylocity, ADP, Trax, payroll systems, and Benefit Mall. They also integrate with Heartland, which is an NTMA payroll sponsor provider. That means that those systems are already embedded into this, and it makes it very easy to use. I doubt you'll use the telemedicine feature if you're going to use the medical. But if for some reason you're not using the medical and you want to use telemedicine through this offering, it's available. And you can also access identity theft protection as well. These are services that you would buy directly from eCentral. As an HR on the person on the administrative side, there's a link on the system that would allow you to access that directly with eCentral, and you can purchase those services on your own. In terms of the install process, very important. This is a process, and we are continuing to modify it as we go through it. We can build these sites in as little as a few hours in terms of once we have all the information, but it will take about 15 to 30 days. So while we are capable of managing fire drills, and we do it all the time, we'd like to eliminate that as much as possible. So once we're notified that you've chosen one of the programs, we will start building out the HR tool and get it ready for launch. So on the group end, we're going to need a point person to work with within the group or within the group and their current broker. We'll also need all of the information that you want to include on the website. So again, we'll know, obviously, if you're taking the medical, we'll already have the benefit designs built into the system, but we'll have to build in all of the ancillary benefits, et cetera. If they're outside providers, that's fine. We'll load that information on there for you. Again, we want this to be a resource. It isn't just about purchasing all of the NTMA programs. We want to try to make your business more efficient. And it doesn't make a lot of sense for you to buy some program through the NTMA or an NTMA sponsored program and have to go to some other place to do all of your other work in your other outside products. So again, if you want to bring your 401k into the equation, we'll load that information for you, et cetera. But we do need you to provide that information to us. Once we have it, we'll build the website. We'll then test it to make sure that it's accurate. We'll work with your HR folks. We'll do a review to make sure that all of the information and messaging is correct. We'll then do an HR tool launch. We'll launch the training for HR folks, and if you want us to do employee webinars, we'll be able to do that as well, or conference calls. Most customers typically leave it at the HR level. Some want their employees to see either a webinar or a conference call, but in general, most people don't want to take time out of the employee's day to learn how to train on this. So we will do it either way for you. It's just customized to you. For questions, we've got a help desk through our office, and all of that information will be provided to you. And then if you want to access it through NTMA, they can also do that, and they'll pass it through to us. In terms of the updates, typically those happen annually. We do know that things change. Obviously, you're not going to have the same benefits every year. You may want to add something, take something away, change a product out. All of that will be done on an annual basis. Now, this next bullet point regarding off-cycle updates, this is a service we are going to offer because we want the program to be successful. So this means that if you make a mid-year change, you get a new benefit program somewhere that you want to put on your website, you decide at a later date you want to add your 401k because you like the program, we will do off-cycle updates until we believe that it's inefficient. We're working sort of diligently to make sure that we can manage the inflow of the data. So we'll monitor it on a case-by-case basis. But as of today, if you want to do some changes off-site, we will accommodate those as well. Or off-cycle, we will do that. In terms of upgrades, if you want to use those additional modules at some point, you can, as I said, access those directly through eCentral. And we do know, obviously, that Heartland Payroll is one of your preferred partners. So if you're using Heartland, you want to facilitate that integration, you can work with our office and we'll help you facilitate that as well. In terms of our role, NFP, with the HR technology, this is the one area that will stay with NFP and the NTMA. The technology, as I said, is, we believe, the most important part of the program long-term because it will allow us to aggregate on a global basis information, streamline the launching of new product, and be able to be used as a data gathering tool. So we will not allow outside channel producers at this point. That may change. to manage the technology. So we will handle all the build and launch as well as the member communication. We'll build out all of the all of the website configurations, and we will load all of the benefits for the NTMA and non-NTMA benefits. In terms of the aggregate reporting, we'll provide that to the NTMA on product and demographic data necessary to drive membership. So what this information will give us is things like where most of the membership is coming from in terms of a state, a location within a state, what types of programs they're buying, and allow us to start to customize from there. And then we'll also handle all of the changes on an annual basis within that membership. The other thing that we'll do is we will manage the customer service portal on behalf of the NTMA. So if there are problems with the system, there's a support mechanism to be able to manage it. And then our other role will be to facilitate the outside broker training and management. And I'll speak specifically to that here in a second. So in terms of the distribution channel, as I said at the beginning, we recognize brokers play an important part in this process. This is ultimately going to be a national program. The rollout of the healthcare, as I said, is located in the 6 states that we have. That would be Ohio, Indiana, Pennsylvania, Texas, California, and Missouri. And then we are looking to add 2 states, Arizona and Connecticut, potentially. The ancillary programs, the Guardian programs, are open in all 50 states. There's no state restriction held on the ancillaries. So we do believe that that program will probably grow faster than the medical, just because of that. But in the near term, we had to make some decisions relative to how this program was going to be distributed, because we want to make sure that it's represented correctly, and that the brokers that do access the program are trained on it efficiently, and that we can manage how that activity goes. So currently, in the near term, our office in Cleveland and our national office is NFP is located, I think, probably in all states except Alaska. So we've got full coverage in all states. Any of our local offices are being trained on the programs now, and then you can certainly access them through the Cleveland office or any of your NTMA representatives. So if you have questions, concerns, this is where the process will start. Over this first 6 months of operation, we are actually today starting to look at outside brokerage partners. As I said at the beginning, we know at the local level, there are a number of brokers and agents that support the local NTMA chapters. We believe that's where we'll go first, but there is some criteria that they're going to need to meet in order to become or to have access to this program. So the key attributes that we're looking for, if you have a broker or consultant that you want to be considered, we need those brokers typically to have some type of scale in their respective markets. This would mean size, and also, have the staffing capabilities to be able to manage the program. We obviously want, highly ethical folks doing this, and speaking from an industry perspective, our industry is not always known for that type of behavior. But it is important to make sure that those agents and brokers that are looking to support this program are doing so in a manner that's consistent with the NTMA and its goals and objectives. And then we also know that any brokers or consultants that use this program are going to need to have the human capital necessary to manage the service levels. So there is not just a function here of marketing and service support around the healthcare and the ancillaries. There's also going to need to be the human capital that's capable of understanding the benefit technology, and we've seen varying levels of sophistication. So just have an understanding of that. In the long term, we're looking for the NTMA really to continue to foster education in the program, be a big source of the distribution of the program, and then facilitating service and management of the programs and growth. As I said, this is a long-term process. We do expect all of these programs will get better over time. We expect to add more value-added benefits as the program grows. And then we know from a renewal perspective that we've got very, very favorable renewal underwriting guidelines. So we've eliminated a lot of the up and down sort of highs and lows of healthcare that you may be getting in or out of community rating, and that will take time to facilitate out. So having a clear understanding of the program is very important. We're going to continue to train the regional reps from NTMA to have an understanding of what the program is today and what we expect the future to be. And we will also train all of our local and national offices. Outside of that, we would expect, based on each state, to have 3 to 5 regional partners. It could be more, it could be less. Just depends on the state size and what the interest is in any given state. But there will be regional broker partners, and we will consider everyone. We will put them through a process, and ultimately it will be up to the NTMA to decide who they will allow to access the program. And now I will open it up for questions. Okay, so the first question we have is, are companies in Arizona eligible for 2018's health insurance through the NTMA? Great question. As of today, no, but I would expect within the next week that we will have a more definitive answer on that. So that said, we have had a lot of interest from Arizona companies. We're encouraging you to continue to submit the information. I know that's a pain, but it does help us build a pricing model for Arizona. And if the interest continues to be at such a level and we can get through the insurance regulation component quickly, I would expect that we may be able to offer in Arizona as well by either 1/1 or 2/1 of 18.
Tessa, did that answer your question?
Yes, it did.
Perfect.
The next question we have is Massachusetts a possibility? Yes. As I said before, we spent a lot of time with Etna and the NTMA talking about states on the initial rollout. And just to give you some background, rolling out ancillaries in all 50 states is very simple because the guidelines around association plans relative to ancillaries is very minimal. That's not the case with healthcare. Healthcare, for a lot of reasons, not the least of which is ACA, requires that we go state by state and make sure that we are either in compliance with state regulations around our format. And just to be clear, our format is fully insured. These programs are not self-insured, and we are, by federal qualifications, considered a multiple employer welfare association, or MEWA. Now, that can have positive or negative connotations depending on where you live. Just to understand this, the NTMA is not holding any risk. All of the risk is held with the carriers, and it's all fully insured. So that made our process much easier as it relates to healthcare. But it was clear that the carriers were not comfortable with 50-state rollout because that could make compliance just very cumbersome. So we did look at the states that had the highest level of penetration. We did look very hard at Massachusetts. Massachusetts is just a quirky state. There's a lot of state regulation outside of the federal regulation. But I would say it is a possibility and one we're looking at very hard because we know the members have asked for it. Next question we had was, can we get a copy of this presentation? Yes, this presentation will go out to everyone right after the call. So you've all obviously got your email addresses in here. We'll make sure that we get that to you. The next question we had was, when is the planned start date? Is it the same for everyone in the NTMA? Great question. No. So the program starts for everyone when your effective date is. Our target date for healthcare is 1/1/18. Our target date for the Guardian Ancillary programs is also 1/1/18. We have no issues with the Guardian in terms of those effective dates, but if you come in later, let's say in a March or a May, you would get a shortened year or shortened guarantee period. So we've got a unified effective date on the Etna program. That unified effective date is either 1/1 or 2/1 at this point, unless federal regulation makes us push that back farther. We do recognize, obviously, that most of you are renewing on 1/1, and I recognize also that that creates a problem from your timing perspective. I would say this, I would not hold your decisions and wait on this program. You can always enter later, but you would just get a short plan year, but you can assume that all effective dates will fall to a 1/1.
Debbie, do you have any additional questions that cover it?
No, ma'am.
Perfect, thank you.
The next question came from Paula Martell. I'm in the process of sharing info for a quote, but I'm currently not in a rollout state. You're in Massachusetts. Will we see a quote at least to see if it would be competitive when and if available? Will we have access to the ancillary programs, or are they limited to the rollout states? Great question. I'm going to defer to Brian on the healthcare side of the Massachusetts. Will they get a quote in HAS or not?
If they can give me the information, I will release what rates we have to see if it's competitive. Absolutely.
Okay, so just to reiterate that, the answer is yes. We will give you at least qualified rates, based on what they look like, so that you can compare them. Until we get release on the state or we get compliance release, you would not be able to access the healthcare. On the ancillary side, we have no state limitations on the ancillary programs, so you can access those programs. And just to reiterate, if you access any one of the programs, you will get the benefits technology that goes with it.
Thank you.
The next question came from Terry Aslin. Yes, the presentation slides will be available. The next question came from Tessa Bloom. How will we know if Arizona has been accepted for a 1/1/18 rollout? My assumption would be that communication will come directly through the NTMA, and they will post that on the website.
Or we can distribute it through other channels, weekly newsletters or e-newsletters, those sorts of things.
Yeah, in particular, we'll make sure for you, Tessa, that we'll get you that information as it becomes available. But assume that it will come through normal NTMA communication channels as well. Next question came from Susanna Leland. Where does a broker go to submit his or her information to become a rep? You can do that either through the NTMA, that would be the preferred method, or you could go to Brian Hirsch in our office if in fact you're talking to our folks directly. Susanna also asked the question, does it cost money to utilize other modules inside of eCentral? Good question. We've tried to make eCentral as robust as possible. So the eCentral platform that you get for free is the enhanced version, but there are modules that you can pay for, and those would be paid for directly through eCentral. They don't come through the NTMA or NFP. So if you're interested, I can either have someone from our office reach out to you and give you an idea of what those modules cost. We can get you that information, but I would encourage you to call Brian Hirsch from our office, and that his contact information will be part of the presentation. Next question, are companies in Utah eligible for health insurance through the NTMA? Utah is not one of the targeted states initially. But as I said, again, this is a process. So we're asking all NTMA members to do something. I realize that that's not always convenient. So for those employer groups that are not in the rollout states initially, we're asking that you submit information. Hopefully you can just include us in your marketing process so that it's not something extra that you have to do. It's maybe just one more email that you have to send. Because what we'll do with that information is we will build it into the pricing module. It does two things for us. One, it helps us gauge the competitive position of the program relative to the competitors' products that are out there, as well as the state filed products in each given state. Two, it also helps us gauge interest within the state. So for instance, if we had heavy interest from Utah, that may be a state we would target next.
They could use that for negotiating the renewal if they wanted.
That's a great point. And for those that didn't hear it, Brian's point is very, very material. You can use this program. We view this as a win in this respect. If this program is competitive, even if you can't access it, your carriers aren't going to know that. So if the rates are good and you can use that to help negotiate your existing renewal with your current provider, that we take that as a win for the program. So that would be another reason you'd want to submit that information.
Susanna, did you have any additional questions?
Yeah, I just had another one. So the people who in Utah, for example, for the shops that aren't sitting through the webinar today, are you guys going to make an additional effort to request information from everybody in Utah who's a member of the NTMA to try and get any more, to see who else is interested in doing this in the area, so that, you know, it's not just the people that listened in today, because I'm guessing there's a lot of people that might be interested, but they just aren't sitting through the webinar today.
Sure. This is Matt Gilmore, the membership director from NTMA. We'll continue to push out information on a national level, and we'll also share this information at a chapter level so that you can discuss it and have more material discussions at chapter meetings.
Okay.
So we'll certainly share our presentation with chapter executives so that they'll have those resources as well.
Okay, thank you.
So we had another question from Tessa Bloom, which was for the medical rate, will all members get the same rate, or will rates be assigned by company? Great question. So the initial rate structures that go out for the initial effective date will be unified. They will all be the same based on the benefit design that is chosen. So that means that all the companies that come in on the initial effective date will have the same rate. At renewal, on the medical side, we are going to tier by loss ratio the renewals. So we will get a unified renewal. Let's just say the renewal increase is 7%. That will be tiered by loss ratio. So better loss ratios will benefit. Worse loss ratios will get a slightly higher rate. We have not set the renewal tiers yet. We're working with Etna now to try to do that, but we do know that everyone in the long term, based on the small group process or coming out of community rating, that typically you would tend to benefit from that. I have a question from Tony Crabtree. Do you know how much interest there is in Ohio, and do you expect that to be a go on 1/1? Good question. So this is not state specific. We need 300 bodies across the entire 6 states that we are operating in. We do have heavy interest from Ohio. I don't know if that specifically is NTMA is headquartered here, but yeah, it's been pretty active in Ohio. I really believe, that we should be able to hit the 1/1 goal. 2/1 is probably more likely, just purely from the fact that a lot of people, because of the timing of the rollout, and we would have liked to have obviously done this sooner, but in trying to time this with NTMA's national conference from a rollout perspective, getting it committed to in terms of the up and running, we recognize that 1/1 is a challenge for everybody. So what we try to tell people is we're going to get you the rates as quickly as we can. We've already released some rates on the groups that have submitted full information already. and we're doing our best to try to get to that 300 mark by 1/1. But, you know, recognizing probably 60% of employers renew on 1/1 and they already want to be done with this decision, you know, that may cause it just to go to 2/1 because people had to make a decision. But I don't expect that we'll have a problem meeting the deadlines for the participation.
Tony, do you have any other questions?
No.
All right.
Next question came from Michael Bonning. If we are already with Etna as of 12/1/17, will we be able to look at joining this program at 12/1/18? It's a great question. You can actually look off-cycle as well, but yes, the answer is yes, you can. We've had a number of existing Etna customers who have already, I think, submitted information, and it's been pretty competitive so far. So again, most of you that are fully insured, and I believe that's most of you, you're typically on a 30-day contract, even though you've renewed for 12 months. So if you want to look at this program 2 or 3 months from now, you certainly have that capability, but absolutely you'd have it at the renewal date of 1/1. Is there a demo of eCentral we can try? That is a great question. Brian, what is the eCentral demo?
I can actually set that up for Teresa. I can actually do one for them personally.
Okay, so we have 2 capabilities. I think we've got a link that will take you through just sort of a 2.5-minute demo, and then we can also set up individual organizations, either make that request through the NTMA directly or through our office, Brian Hirsch, and we can do it directly.
Tessa, if you want
Yes.
to, I can get your email address, and I can work with you and put you in contact with Brian, so that way you can work on going through the demo.
That would be great.
Thanks.
Are these plans available in Missouri? Yes, they are. Next question came from Don Murphy. Is 1/1/18 realistic if a census was sent early last week? Brian.
If I receive everything, I should be able to get rates out to you yet this week. So if I received everything that has been requested other than just census, the answer to that would be yes, I'd be able to get rates out.
All right. Well, we didn't have to fill out health surveys, you know, or questionnaires due to the fact that we had in place and we're over 20. So I think you should have everything in your formats, but I was just curious because it's, you know, kind of down to the wire. So.
Yeah, and we do recognize that's a challenge. But if you've submitted full, complete information for what you're looking for, we should be able to get you that information.
Yes.
Realistically, how long before we got a quote back?
When you give us the information, if it's complete, when Brian sends it to you, you'll have the quote, and you'll be able to look at rates.
So if I have that when I get back to my office, I should probably have that to you by tomorrow.
Okay. Okay, because I submitted it online. I just never received any, you know, confirmation or anything. I didn't know if that was a...
What's the name of your company, Don?
Miller Brothers Machine and Tool. We're out of Wright City, Missouri.
Okay, we'll look for it and we'll figure out where it's at.
Okay, on another question that I have, if you scroll down a little bit further, you'll see the next question that I had. Are you guys going to do any kind of tiered schedule, like a premium to pay for rates as people come in years later?
Am I on mute or no? Oh, sorry. So I just want to make sure I understand. So the people would have to pay into the program because they came in later?
No, we've looked into a couple other organizations who have done these type of rollouts, and for the manufacturing industry. And they've been, you know, had this program for like 20 years. So the initial people got in at the beginning, and they get, you know, their rates are frozen for, you know, a couple years, and there's never more than a 6% increase. And of course, they get all the benefits from that since they were in at the beginning. And so will everybody else who joins, except The first year, they pay a 15% premium on top of the regular rates. Second year, it's reduced down to 7%. And then by the third year, you're just like everyone else who's, you know, you get all the other benefits.
Yeah, so what you're describing is some type of self-funded consortium association. That would not be the case here. So this is fully insured. The NTMA itself is going to be rated as a single group, a single large group. So when Etna looks at all of these small groups that are in this pool, it is going to look at them solely as the NTMA. It's going to produce a renewal based on that experience, and that renewal is fully insured. So there's no subsequent years buy-in, reserve requirements or anything like that. This is all fully insured and pretty standard.
So as long as you're a member, whenever you decide to get in, whatever the rates are that the NTMA has right then, those are the rates that you would qualify for if you didn't have to fill out health questionnaires and all the other stuff.
That's correct. So the one caveat I would give you would be if you came in and say March, you would get like an 8-month rate versus a 12-month rate because everything renews on 1/1.
Gotcha. Okay, well, thank you guys. Appreciate it.
Yep. I have a question from Eric Hagapian. Our company is in Massachusetts. We have a very strong broker in our region that writes many companies in the region. With whom should I have them contact to begin discussions? I would send that information directly to Matt, and then we'll get that process started.
Eric, do you have any other questions?
No, that's about it. Thank you.
Thanks.
I have a question from Tim Strubberg. Can our local NTMA office in Missouri tell us the possible brokers involved on a local basis? We don't have any broker candidates at this point in Missouri. If you have broker candidates, then I would forward them to Matt. In lieu of that, you know, we've got NFP offices in Missouri as well. I can direct you there if you're looking for a local provider.
Tim, do you have any other questions?
Yeah, that's fine for that one, and then take a look at the other one about the employees being able to join.
Okay, I'll have him read that one right now.
Tim's question was, I cover the employees and they only pay a copay cost. Can employees bring family members into the program? So I believe you're saying that you only pay for employee coverage only. Is that correct?
Yes, I pay the employee, not the family. And
yeah, so that's a structure component for you. That would be at your decision. So Etna's coverage obviously allows family as well as other tiers. You know, employee plus one, employee plus children, employee plus spouse. However you want to set up your program, you can do that. Employees, you could pay for employee only if that's your choice. But yes, it would support that.
it would support the employees being able to use this system for their family members.
Correct.
Okay, that's fine. Yep, sounds good. That's all questions.
Thank you.
Next question comes from Scott Livingston. What if we have operations in multiple states? Example, Connecticut and Massachusetts. We are already limited to insurance carriers who have good networks in both states. We have explored all kinds of options to lower our costs and mute the future increases. That includes going self-funded, HRA, and a number of other strategies. This is a PPO program through Etna, so it is supported in multi-state cases. We do know that there are a lot of NTMA members that have this situation. So Etna is a national carrier. I think you would have to evaluate their networks for your particular issue, but in fact, it would support that delivery. You also had a question, this may have been covered in the first part of the presentation, but what if Etna has been non-competitive at quoting us in the past? We've heard a lot of that. And what I would tell you is, if you are in the Etna small group rating model today or part of one of Etna's community rated processes, this is different. So the rates are unique to NTMA. This is not an Etna off-the-shelf program. That said, it may or may not be competitive. Like I said in the initial part of the presentation, of the groups that have submitted information, about 40 to 50% are very competitive, and that can mean different things to different people, but as we've seen it, that's what we're seeing today, and that fits within our target. This isn't going to be the product for everyone, but it will grow over time, and as we start to expand it, we may be able to expand to, narrow networks, things like that may make some of the programs more competitive. So, as I say to everyone, I think it's worth going through the process, if for no other reason than to help the NTMA build a database of information to work off of. But for the Etna programs for the folks that have been with Etna, I think by and large, most of those folks are getting more competitive rates through the NTMA. I think it just depends on whether the NTMA pool is better or worse than what you're seeing in general.
Scott, do you have any other questions?
Just in terms of response, number one, I appreciate the answers and the feedback. I mean, it seems like there's a lot of interest here, and most of us wouldn't have spent 90 minutes on the phone if there wasn't a compelling reason to. Obviously, this is one of our biggest expenses. In terms of our concerns, number one, it's simply the pricing. That's why I asked the questions about Etna. It makes no sense if we can't save money. And then number two would be just the fact that most of us have deep relationships with our current brokers, and this would be a big change in how we approach those sort of non-value added or value added but non-directly related benefits.
Yeah, I get it, and I think if I look at the two biggest hurdles, distribution is one. Obviously, and we've heard from a lot of people that brokerage relationships are key. So if you have a strong brokerage relationship, I would encourage you to have them reach out to Matt and let's see if we can include them. All we want to make sure is that distribution is solid across the country and that the people that are distributing the program are doing it to justice that it needs to succeed. And then secondly, you got to remember, if this pool grows correctly, and we believe that it's set up to do so, it will be competitive over time. That doesn't mean that it's going to be competitive for everyone at a given point in time, but it should, on a long-term basis, be more competitive than what a small individual group would see typically in the open market. And then I've got a couple more questions from Karen Latin. If you don't have a current group plan, when is the soonest your company would be considered for participation? I assume that to mean that you don't offer coverage today. That's unfortunate. We don't have the ability to offer what we call virgin groups at this point. But I think once we are up and running and actually have the program to its capacity of 300, I think that will probably change. So I would look to see an update for that probably sometime in the first quarter as to whether or not we can start to offer. Rick, let's see, I'm sorry. Karen also asked, if you submitted online information, will they get in touch with you to let you know whether or not you are eligible or not? The answer is yes. If you've submitted information, you will be contacted and you will get a response back. Rick Benward had asked, is this going to be an age-based pricing format, or will it be employee, employee, and spouse, and so on? The answer is yes, it will be employee or tier rated. It is not an age-based program. The last question, if I go through the process and I don't like the rates, do I have to go with them? Great question. The answer is no. There is no obligation to take this program. As I said, we are really, hopefully, you at least go through the process and submit the information. If nothing else, it will help us gain some market share intel that will help us design it, but you're under no obligation to choose it.
Hey, Debbie, I'm going to have Matt Gilmore. He's our Director of Membership and Business Development. I'll have him contact you so that he can he can talk to you about your broker.
Okay, thank you.
You're welcome.
And I think that concludes all of our questions. I'm sorry we ran long. I apologize. Probably should have cut that presentation down, but hopefully it was beneficial for everybody, and we'll get this information out to you as soon as possible.
Thank you.
Thanks, everyone.
Bye.